An ICU nurse at Hillcrest who has been treating COVID-19 patients is asked to be transferred now to a different unit because of the toll the pandemic is really starting to take on her professionally.
She says she and many of her co-workers are feeling burned out. News on 6's Jordan Tidwell has that nurse's story for us tonight. Jordan?
Lori, she says at the beginning of the pandemic, healthcare workers were treated like heroes, but it doesn't feel like that anymore, and many are reevaluating. They still want to work in healthcare. In the COVID ICU at Hillcrest Medical Center for the past 18 months.
When it first started, it was a lot of unknowns. It was pretty scary, and we kind of all felt like we were putting our lives on the line a little bit because we had no idea what we were dealing with.
She says they are now losing so many patients with the Delta variant, and the patients keep getting younger. She says it was hard to go into work without being filled with anxiety.
With this new wave that started in July, it almost seems like it's never ending, and it doesn't really seem like we're doing as a society what we need to do in order to stop COVID from continuing on.
She says in August, she wanted to keep doing her job as a nurse, but knew she needed a change. She asked for a transfer out of the COVID ICU and is now working in ICU, but not treating COVID patients.
So that's been kind of like a sigh of relief, and I can remember why I love to be a nurse, and it's not so much about like COVID all the time.
She says many nurses feel the same way, and she wishes people would get vaccinated and wear a mask.
We aren't expecting like rewards as nurses. Like, we don't want people to like put up banners for us. We just want people to like care for one another, because that makes our jobs a lot easier.
The state health department says right now there are 399 patients with COVID in ICUs across the state. Live in Tulsa, Jordan Tidwell, Oklahoma's Own, News on 6.